Tonight's special segment, eyeing your arteries. Now, you may look and feel one way on the outside, but your arteries could actually be functioning older than they really are on the inside. Our Health Beat reporter Sylvia Perez is here to explain why this is important and also how doctors are now figuring this out.
Alan, blood pressure, I should say, weight, family history, these are the typical risk factors for heart disease and stroke, but some cardiologists think they now have another powerful tool to determine the risk of cardiovascular disease. It is an easy, pain-free imaging test that peers into arteries to give patients a heads up about their coronary health and whether it is heading for trouble.
Happy birthday!
They come once a year, whether we like it or not. Our birthday determines our chronological age or the number of years we've been alive. But some cardiologists say there's another number we need to learn about, something called vascular age, and it can be calculated with a special FDA-approved procedure.
It's a test where we can measure the first two layers of the carotid artery and get a measurement of the earliest phase of atherosclerosis or hardening of the arteries.
The thicker the artery, the older or less healthy it is. That estimated thickness is what helps determine an approximate age for the artery. For example, Linda Brennan will be 60 this year, but her arteries were looking like those of a much older woman.
We'll be 60 and my vascular was 80. That's 20 years. That's not too good.
The University of Chicago Medical Center now offers this procedure called the CIMT test to patients. Several hospital employees were the first to give it a try. It uses standard ultrasound technology to provide a view of the carotid artery, which carries blood from the heart to the brain.
The thickening in your carotid artery, again, mimics thickening or atherosclerosis that's developing throughout your body.
Measuring the wall thickness is an old idea. What's new is the computer program that then takes that measurement and calculates a vascular age based on the thickness and your chronological age. The idea is to give patients a sense of what's going on in their arteries long before there are any symptoms or signs of problems, so steps can then be taken to halt the damage or reverse it.
It can serve as both incentive for patients to enact healthy lifestyles, both diet and exercise, and it can also be used by physicians to change targets or medication adjustments to try to treat those risk factors.
Keith Collins gets plenty of exercise and claims to eat well. His vascular age was calculated at 31, not bad for a 41-year-old man.
I just wanted to see if I was doing the right things.
The test is for people who are symptom-free but with risk factors such as being 40 and older, having a family history of heart disease or stroke, being overweight, or having high blood pressure or high cholesterol. Linda has been dealing with several medical issues. She says her vascular age of 80 is a wake-up call and now realizes she needs to think seriously about diet and exercise.
It hits home. Definitely hits home.
Experts say this test is accurate and it is safe. The cost is about $325, and that would likely have to be paid out of pocket. Some cardiologists would like to see more research that proves the test can, in fact, help prevent a first heart attack or stroke. This test is user-friendly, so patients can understand the results along with their doctors. That's important.
Yes, it is.